Many times in other models, especially the mechanical model, we are taught to do the still point via the tissue, the bone specifically, and very often it would be, say, the occipital bone, and you would pay attention to, or the temporal bones, and you'll pay attention to flexion and extension, and then when the bones, you're following them back into extension, you're going to ask and slightly demand for them to do that for you. In this model, we're going to do it via the fluids. So you're going to tune into the fluid movement and not so much the bone. It's a little bit deeper access to the system. So pay particular attention to exhalation. And as you're listening to this longitudinal fluctuation of the fluid from the midline and its power, its drive, make sure that you're really kind of focusing a little bit more, still holding the large field, but holding more of the exhalation phase. And then at its furthest expression of exhalation, you'll notice somewhat of a wobble. And then as it goes back into flexion and everything fills and widens, there's a boundary there. And you will ask right before that boundary if the system would like to do a still point, or pose any question of that nature. Would you like to go into a still point? Would you have value? It's a subtle intention, and it will fire through your system, and it will enter into the field. You're literally encouraging the system to wait at that edge, at that wobble. So you hold the intention, and that subtle intention will be manifested in your hands. We are absolutely negotiating and not demanding, and that's the difference really between the work of the mechanical model and the biodynamic model. We're asking, and we're asking in a gentle manner. There will be no barriers created, which the mechanical system uses. It's almost like the locks in the Panama Canal. The water kind of bangs up against that, but it's firm, and then it closes more. We don't do that in this. We ask gently at the boundary, and we follow the system. We're just initiating, essentially, a two-way conversation because the system may not be ready for it, may not need it, may not be able to. Now, we talked about the different fields, wide, mid, and biosphere, and you can use any one of these fields, although I think sometimes in this particular technique it's better to use the closer field, the biosphere. It's a little bit more of a swaddling. And of course you don't have to, but let's just try that for now. Use the biosphere, that cocoon somewhat around 3 feet around the body, and use the mid-tide, and it's valuable to count when you're first becoming aware of the fluid tide. It's okay to continually count through entire practice to know that you're in there if that's what it takes. And it's that in, out, about 2.5 times a minute. So 10 to 12 seconds, so to speak, in flexion and extension. I would say one of the most important things you could do is just have a baseline concept of the amplitude and the width, so to speak, how much the system fills and goes into flexion. How wide is that? And then a sense of the movement back into the midline and the narrowing and extension. Just really get a good sense of what that feels like so that you'll be able to tell if the still point has had an effect on the system, so to speak. Depending upon the cranium that you're holding, you can start with any handhold, but it's always, I think, excellent to use Sutherland's if your hands will accommodate you to that cranium, and if not, Becker's. And then after you have listened at that sense and that place, then I would suggest maybe moving into the occipital hold and listening to the fluid as it moves laterally. Of course, we know the bone movement is moving in a different direction than the fluids. The fluid is moving more laterally and filling, and then we'd like to pay attention to that. And then what I'd like you to do is give your patient a lot of space. One of the things that I like to do is pretend that my hands are actually laying on the floor below my table, so that I'm not so interested in what's happening in them. And then what you can do is listen with lots of space around them to the dynamics of that movement, the fluid movement from the midline. Does it feel different from the left side to the right? What's the amplitude like? Kind of get a sense of the estuary-like movements of the system. Does the system move more easily into flexion? Does it move more easily into extension? Just observe, give the system plenty of space. And after enough intervals of flexion and extension, start paying more attention to the exhalation phase. And focus on the receding of the fluid. And get a real sense of the boundary of where that is before it goes back into flexion. And when you're familiar with that, and you have a real clear sense of where that is and what that feels like, ask subtly, would you like to go into a still point, or any question of that nature? It's an inquiry. It's a question. It is not a demand. That's the essence of the difference in the two systems. Of course, you have to listen very closely to the answer, so to speak, of your subtle intention. The fluids will respond to your suggestion. And conversely, if you don't get a response, don't demand it. It's not the appropriate time. Remember that the system, the fluids, have an intelligence very capable of making decisions, and in my opinion, more capable than my needs, or my wishes, or my inferences, or my desires as a practitioner, as a human being. Their system, the intelligence within the fluids and the tissues, is extremely capable of making decisions for itself. You may have to listen to a few cycles. The system may not be ready for that. So be aware of that. And there's times that I just move on. I may ask 2 or 3 times and I don't get a still point. It's like, okay, not a time for a still point. In the thousands of hours that I've sat on the table, and the thousands more that I will, I'm sure I'll see that again and again. That's the art form. If you're paying attention without focusing down into the system and creating issues, you may notice something. Maybe it goes into a deeper exhalation phase. Maybe it slows down. Maybe the flexion is bigger. Maybe the wobble that you were aware of is less now. It's smoother. It moves back and forth effortlessly, where before there was kind of a staccato feeling to the change. And it may occur a number of times. You may even notice something get kind of wacky in the fluid system. It may even start to disorganize a little bit. Oftentimes that chaos is actually a signal that a still point is about to happen. It's classic. When you start to pay attention, you will begin to see the signals